Alright, hi everyone. Today is our group turn to present on the next topics for the subject ABD 7213 issue and ethic counseling. But so we really do hope that you guys are excited to learn and to listen to our presentation. But first and foremost, we would like to show our gratitude and appreciation to our respective lecturer, Dr. Rosli bin Ahmad, for all his guidance and teaching throughout this semester. So without further ado, let me continue with our group presentation. So we will present to you for the topic of counselor as a person and professional. So our group consists of 3 persons. The first one is myself, Sareh Safwan bin Abu Seman. I am pharmacist from Ministry of Health. The next one is Mrs. Noor Binti Yusop from KBS. And last but not least is Mrs. Fazrine Binti Ahmad Zubir, police officer from KDN. Okay, before we proceed further with our presentation, I would like to give you a brief introduction video just to show you how it's all about being a counselor. So this kind of example, I got it from the overseas. So the closest example that I can search lah for this purpose of presentation. So hopefully you guys enjoy it.
So my name's Lisa Menzel and I'm a counsellor and I work in my own practice called Well Within Counselling. So within a 1 hour session, there's a few key stages that we need to work through, and the first one is to allow for the client to open up and talk about what they're presenting with. Some clients are really happy to open up and sometimes other clients are a little bit more reserved. I might change things up a little bit by getting out my strengths cards, and that really breaks up the session. I think a good counsellor is someone who is authentic and genuine and able to build a relationship really quickly. Every year I update my skills to just stay in touch with new and emerging research. Some of the areas that a counsellor might work in is in the community services field or the education sector, or working privately and working with issues such as substance use or family conflict, family breakdown. Hearing some sad stories day in, day out can take its toll on a person. It's important as a counsellor to debrief with my supervisor or a colleague so that we then don't take those issues home. It's important for me to really empower the client and for them to leave the session feeling like that they've achieved something. It's one of my own strengths as a person. I like to help people.
Alright, so as we can see from the video, as day in, day out as being a counsellor and what we are doing now, learning to be a future counsellor. So we can see, we can briefly understood by the topic itself, counsellor as a person and as a professional. So counsellor itself, we are also a human. So as a human, we have our own personal qualities and we have our own strength and we have our own weakness. So this kind of issue will be brought into sort of ethical concern when we deliver our service as a counsellor. So it is what it's all about for our presentation today. So for as a start, I'd like to show you what is our learning objective. We have 7 learning objectives for this presentation. The first one is to appreciate the role of counsellor, self-awareness in ethical practice. The second one, provide the rationale for the importance of the personal therapy for counsellor. The first and the second will be presented by me. The third one is clarify of counter-transference can be an ethical concern and view client dependent as a potential ethical problem, which will be presented by Mrs. Noor Azleen. And the last three describe the main sources of stress that counselor must address, understand how stress can lead to therapist impairment, and develop a personal strategy for ongoing self-care will be presented by Mrs. Fazrine. So as an introduction, so a role of counselor as a person and as professional in the therapeutic relationship with the client is integrally related. So we cannot run away from this situation because we as a counselor, as I mentioned before, we are a person, we are a human, that we are prone to any personal issues. So counselor, as what we really intend for our client, we also have to look honestly at ourselves and willingness to challenge ourselves to do change or improve as the same reflection as we intended on our client. So some question that we can ask ourselves as a counselor: what strength do I have that assists me in helping others as well as myself? And do I possess any qualities that are barriers for me in being helpful to others or myself? How might I create a plan to address this barrier? And am I doing in my own life what I ask others to do in their life? So this kind of question should be repeatedly asked by us just to keep our motivation to be a counselor going on. So as what we do today, counselor in training, we are in a training of becoming a future addiction counselor, acquire an extensive theoretical and practical knowledge as the basis of their practice. So this is the fundamental of becoming a future counselor. So tendency, we as a counselor will have a tendency to bring along human qualities and life experience to every therapeutic session. So we have to strive to be an effective change agent toward our client. And compassion for others and dedication to serve others are the hallmark of being able to make a difference. And therapist's personal needs and problems can represent ethical issues for the client-therapist relationship. So this issue is what going to be questioned as an ethical if we cannot find a balance. So as a chapter overview that we are going to discuss in this presentation is about the consideration of counselor personal qualities and personal life which may affect his or her professional behavior, ways how counselor personal life impact on professional life, and how the professional works affect the counselor personally. So it's a two-way issue that could impact interchangeably. So a counselor belief, value, personal attribute, level of personal functioning, and ways of living inevitably influence the way he or she carries out a professional role, which to us is essential to ethical practice. And the counselor personal life and professional identity, such as self-awareness, influence of counselor's personality trait, goals, personal needs, transparent, counter-transparent, personal dynamic, job stress, balancing life roles, and therapist self-care is what we're going to present throughout this presentation. So as for my part, self-awareness and the influence of the therapist's personality and needs. So as a counselor, we must aware of the influence of our own personality needs and life issues, such as area of unfinished business, personal conflict, defenses, and vulnerabilities. So what this means is, dengan izin, let me talk in bahasa. So sebagai seorang manusia biasa, kita tak boleh lari daripada masalah peribadi kita, masalah keluarga dan juga masalah di tempat kerja. So kita kena ambil tahu dan kita kena betul-betul aware dengan situasi yang berlaku terhadap diri kita, kerana perkara-perkara ini boleh dibawa semasa sesi yang akan mempengaruhi keberkesanan sesi yang kita jalankan bersama klien. And the second one, without high level of self-awareness, so the therapeutic relationship can obstruct can be obstructed by this kind of issue, and as well as the therapy progress. So therapy could shift from meeting clients' need to dealing with the inadequacy of the therapy. So that's why it is important for the counsellor to settle uh, him or her personal issue first before taking the responsibility to attend the client. So example of personal needs of counsellor based on unresolved personal conflicts, such as need to tell people what to do. Sometimes we get emotional, maybe this kind of issue might turn out to happen. Strong desire to relieve all pain from clients, like we are trying to be perfectionist towards all clients' problems. I need to have all answers and be perfect, just what I mentioned just now. And intense need to be recognized and appreciated by others. So this is also another issue that counsellor might encounter throughout their profession. So the next one is personal characteristic of effective counsellor. So we as a person are different. We are different in personal qualities. So it's just like me and you. We have different strength and weakness. So this is just an ideal helper traits that enable counsellor to establish and maintain a good working relationship with their clients include. But having said that, these kinds of traits can be trained or can be learned throughout our profession, such as being aware of the strength and the weakness, having a curiosity and openness to learning, interpersonal skills that can be used in counseling, genuine caring and compassion, showing respect for people who differ from you, taking care of self, a healthy sense of selfless and pride, think of traits, and is the most essential. So this is why it is important for the counsellor to keep enhance or to keep themselves getting better and better throughout their profession. So just to draw your attention, what would you make a good counsellor to others based on your personal type? So remember, at the beginning of today's session, we have asked you to do the personality type. So only you can answer this kind of question based on your personality type. Motivation for becoming a counsellor. As a counsellor, we need to be the possibility of working primarily to be appreciated by others instead of working towards the best interest of the client. So this is also another loophole that could be an ethical issue for the counsellor. So we should ask this kind of question frequently. So what are my motivation of becoming a counsellor, and what are my reward for counselling others? So interfering motivation, goals of therapy may suffer when a counsellor with a need for approval focus on trying to win acceptance, admiration, and even awe of the patient, of the client. So something that sometimes that we cannot avoid, the personality that we have. So this kind of issue we should avoid in the first place, just to make sure we preserve the therapeutic relationship with our client. So some concern and challenges faced by the counsellors. So as becoming a counsellor, it is inevitably that we will face a lot of challenges, especially during this time of COVID-19 pandemic. So time had been changed a lot for us from all aspects of our life. So that's why we have to always get prepared for what is coming to us in the future. So this is just a list of issues or concerns that could be dealt or challenged or faces by the counsellor, such as dealing with the anxieties. So most of us have our own anxieties, being real self and self-disclosure, avoiding perfectionism, dealing with clients that tested personal passion, dealing with clients who lacks of commitment, tolerating ambiguity, avoiding losing real self in clients, establishing appropriate personal and professional boundaries, developing a sense of humor, sharing responsibility with the client, developing collaborative relationship with client, declining to give advice, defining the role as counselor, developing personal counseling style, and last but not least, staying vital as a person and as a professional. So it is a dynamic kind of problem that we will deal day in, day out as a counselor. So it is very important when become a counselor. Personal therapy. We as a counselor ourselves, we do need personal therapy just to make sure that we can perform well throughout our profession. So it is beneficial to both trainees and experienced practitioner. It is to show the importance of personal therapy during training for future counselor. Because when we did our training as what we do now, it is important as well that we learn how to do the personal therapy for ourselves. Because this kind of skill and knowledge we will bring together when we go out to become a future counselor. So it is necessary form of ongoing self-care. So the reason for doing the personal therapy is to explore our values and motivation for becoming a helper, how our needs influence our action, and how we use power in our life, and to identify and explore our blind spot and potential areas of counter transference. So this is will be further discussed by Mrs. Azleen afterwards, and also for remediation purpose, which is to maintain self-care and competence. So self-care will be further explained by Mrs. Fazrine. So self-care for counselor is very important because I like to draw your attention with these quotes by Eleanor Brown. Rest and self-care are so important. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel. So that's why we as a counselor, we cannot serve people if we in an empty glass. So we have to make sure ourselves is in a full. We have cater our own self-care first before we help others. So this is where to highlight about the importance of the self-care, because positive self-care yields caring helpers. So this is just an idea of self-care, because we ourselves, we have our own hobbies, our own interests in doing what we love, what we like to do with our lives, right? So this is just a simple example that we can follow. So that's all for my part. So I would hand over the next part of this presentation to my next group member, which is Mrs. Noor Azleen. Please help yourself.
Thank you, Mr. Sareh, for the excellent presentation. Assalamualaikum and a very good afternoon to Mr. Pradeep and Mr. Utaya. I'm Azleen. I will continue my presentation on the topic of transference. Transference is the unreal relationship in therapy. Transference describes the situation where the feelings, desire, and expectation of one person are redirected and applied to another person. Most commonly, transference refers to a therapeutic setting where a person in therapy may apply certain feelings or emotions toward the therapist. Transference is a psychology term used to describe the phenomenon in which an individual redirects emotions and feelings, often unconsciously, from one person to another. Okay, next. As you can see, this picture is created a counseling session At the right is the client and the left is a counsellor. The client said thank you, while at the same time he judged the counsellor by viewing the messy paper on the desk, a bit of breakfast on the cardigan, and at the same time he also think that the counsellor is aged around 50. For the counsellor, she said, please take a seat. At the same time, he also judged the client as a 35 years old, good looking and quite financiable. As you can see, the transference occur when the client judge the counsellor, and the counter transference is a response from the counsellor towards the client. Okay, next. Okay, here another example of the transference where it's between the patient and the doctor. Transference is what the patient feels toward the doctor, while the counter transference is what the doctor feels toward the patient. In this case, patient feel the authority as a god, father, mother, dependence, anger, inability, sexuality, will to power. And while at the same time, the doctor feel the sympathy, sadness, difficulty, anger, frustration, disinterest, annoyance, insecurity, and fear toward the patient. Okay, next. Okay, transference is a process whereby client projects onto their therapist past feelings or attitudes they had toward their caregivers or significant people in their lives. Okay, in Malay, transference ialah proses yang tak disedari oleh klien terhadap kaunselor sebagai individu yang signifikan di dalam hidupnya. It can be said that it happened based on their his or her experience. The client may have positive or negative feelings. At the same time, she also expressed their love, hate, confused, and dependent. In this picture, it shows the girl in between. She had a past experience that her mother feel unconfident to deal with her. And by the time she was adult, she went to therapist, and she also think that the therapist might have the same thought as her mom. Okay, next. Okay, transference, in other words, is transfer, transmission, movement, conveyance, passage, disposition, displacement, translation, and transport. In Malay, it can be said as a pemindahan ataupun penyerahan. Okay, next. Okay, transference is the unreal relationship in therapy. So, counsellor need to be aware of their personal reaction to the client transference. It is important for counsellor to be aware because they have to respond to the client after that. Okay, next. Okay, transference is unreal in relationship in therapy because all the reaction of clients to the therapist are not to be considered as transference. So that counsellor must be smart in managing and control their feelings in front of the client. Next. Okay, transference is unreal relationship in therapy. So that when dealing with client, counsellor must dealing appropriately with transference because it is an ethical issue. So counsellor must be competent in dealing with the client so that he or she don't break the code of ethics in counselling. Okay, next. Okay, next we go to counter transference. As I mentioned before, counter transference is a response from the counsellor towards the client. In counter transference, the therapist or counsellor total emotion response to a client including feelings, association, fantasies, and fleeting image. It can be either constructive or a destructive element in the therapeutic relationship. You see, in this picture, as a counselor, we might see the guy as a devil or angel maybe. Okay, next. Okay, counter-transference occurs when the clinician demonstrates inappropriate effect. As you can see in the picture, the right picture, counselor is talking in phone while the session. While at the left picture, the counselor is listening to music while the client is expressing his or her feeling. This is very inappropriate lah. Okay, next. Okay, counter-transference occurs when the clinician responds in highly defensive way. As you can see, the situation, the counsellor sees the client as a worst situation and they respond at the worst words they can say. See, when he responds, you are right, Carl, everything does suck. That one cannot be practiced by a counsellor. And another example, when he see the patient as a kind of that gonggok, I think, as a human being, you are total failure. Means he see that the client is hopeless. Okay, next. Okay, another thing, counter-transference occurs when clinicians lose their objectivity because their own conflict are triggered. In this case, the counsellor might also see the client issue as theirs. Okay, as a human, there is a situation where the counsellor also face an ethical issue, and that may influence his or her judgment towards the client. As you can see in the picture, when the client express their feelings, the counsellor thinking of another thing. He might think that he was at that place. The words that make two of us, put him in the client's place. Okay. Okay, next. Here are the examples of counter-transference according to the books. Firstly is being overprotective the client, means terlalu melindungi lah. Yang kedua, next is treating client in benign ways. Benign means lembut. Maknanya di sini counselor melayan client dengan terlalu lembut, lemah lembut. The third one is rejecting the client, menolak client. Number 4 is needing constant reinforcement and approval. Dalam keadaan ini mungkin kaunselor mendesak klien itu. And then the fifth one is seeing yourself in your clients, means kita mirroring lah, kita menganggap menampak diri kita dalam masalah klien tersebut. The next one is developing sexual or romantic feeling for a client. This one mungkin kita melihat klien itu sebagai bekas kekasih, ada persamaan seperti bekas kekasih. Next one is giving advice compulsively. Tak sepatutnya kita sebagai kaunselor memberikan nasihat instead of membimbing klien. And finally is desiring a social relationship with the clients. Ini terjadi apabila sesetengah kaunselor mengharapkan hubungan sosial yang lebih lah dengan klien walaupun selepas sesi. Okay, next. Okay, client dependence. Client dependence is a temporary dependence. It's not necessarily problematic. An ethical issue occurs when counsellors encourage and promote dependence. It can manifest in subtle way. Counsellor may keep client dependent and termination can be delayed. Okay, dalam situasi ini, kaunselor kadang-kala membuatkan sesi klien berlarutan dan tidak memberi penamat kepada sesi. Situasi, okay, the situation is continuous may promote the client to be more depends to the counsellor. And when this happens, it will lead to an ethical dilemma on the client, on the counselor, because he or she is unable to control and manage the client. Okay. Next. Okay, for better understanding on the topic of transference and counter transference, let's watch this demonstration.
Honey, I'm going to wear the red dress to your corporate event.
Well,
That red one, remember?
it's beautiful dress. But it's official event. We need to wear formal clothing there.
You are too much. You are too bright. Can you stop wearing your blue here to the school so I'm not feeling like I'm an idiot father? You know what? I'm mature enough to make my own decisions what I'm going to wear. I'm your mother, and I know much better what you should do. You are not going anywhere, and you are staying home. I'm the boss.
You know what? We were talking about this for 3 months, and now you are trying to bring your rules even into my work. Then I'll go there by myself. I don't need wife who cannot support me even at official event at my work.
You will do what I tell you to do. You are so selfish.
Okay, di dalam video ini, kita dapat lihat Helen masih dihantui bayangan bapanya, yang mana dia menampak Bob, teman lakinya ataupun suami, tidak membenarkan dia memakai pakaian yang disukai. Dan pada masa yang sama, pada pihak Bob, dia melihat ibunya dalam penampakan isterinya Helen, apabila kata-kata Helen tu mesti dituruti dan tak boleh dibantah. Jadi di situ berlaku counter transference. Jadi setakat itu sahaja presentation from me. And now I would like, thank you very much. I would like to invite my team members, Fazrine, to continue on her topic. Thank you for all of you for the lending your ears to listen to my presentation. Thank you very much.
Thank you very much, Ms. Azleen. Okay. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to the our honorable Dr. Rosli, our lecturer, and our beloved friends. I will continue my part with stress in counseling profession. Okay. As you know, our first presenter that tell us about this profession, helping professionals engage in work that can be challenging and emotionally taxing. Stress is an event or series that leads to strain, which can result in physical and psychological health problems. This is because the process of therapeutical of counseling professional with people can affect a therapist's life and result to counter transference, like Ms. Azleen said just now. So the counselor tend to be deeply affected by client's pain because overly responsible. That will lead to stress. It is important to maintain healthy and empathy balance and practice self-care to maintain variety of the counseling profession. Next. Okay. Empathy fatigue happens when stress generated by listening to multiple stories of trauma that client brings to therapy and mirror to therapist's own personal life. Personal struggle too closely. Monitoring the empathy fatigue is critical for maintaining the emotion, physical and spiritual being of a counselor, the therapist. This professional experience demonstrates empathy towards clients at greater risk of compassion fatigue. Compassion fatigue is a condition that professionals fail to recognize and attend their own needs. The more empathic providers are towards their clients, the more likely to internalize their clients' trauma. Empathy balance, being able to enter clients' world without getting lost in that world. And learning to balance caring for others with caring for self is important for a counselor to counterback the stress or coping with their stress. Develop self-care strategies is important to avoid burnout. Next. Okay, this is for the topic of source of stress. Actually, there are a lot of sources for stress. Some of them are feeling they are not helping the client, accept full responsibility for client's progress, accept feeling pressures to quickly solve client's problems, where counselor feels need to solve as soon as possible. The extremely high professional goals and perfectionist striving to counselor striving to solve the client's problem quickly. Then the number 5 is the work of professional counselor can lead to significantly increased level of stress, which impact of client stress. This is because counselor was overly responsible to client's problem. Stress associated with, other than that, stress associated with working in managed care pressure involve getting clients treatment. Okay, for example, stress associated with working in managed care is pressure involving clients treatment approved, getting clients treatment approved. These are all the bureaucracy of clients treatment, justifying needs of treatment, dealing with the paperwork, and also the dilemma when client deny further treatment. Whereas for educational system, for example, for school counselor, the expectation to solve behavior problem of children and dealing with family, teachers, and also administration. Next. Okay, counselor burnout and impairment. Okay, stress, distress, burnout, and vicarious traumatism are ongoing challenges for therapists, counselors, or helping professionals. It is important for therapists to practice self-care to protect effective functioning and provide competent service to client. Neglect self-care can undermine confidence and hurt the ability to practice ethically. Burnout, for example, in burnout is a state of physical, emotional, intellectual, and spiritual depletion characterized by feeling of helplessness and hopelessness. As you can see at the picture, the therapist or the clinician is worse than the client. Okay, and then long working hours, seeing difficult client, involvement in administrative duties, and perception of having little control over work activities are sources that lead to higher risk for emotional exhaustion and burnout. If the person did not take steps to remedy burnout or fail to deal with stress, finally it will lead to impairment. The presence of chronic illness or severe psychological depletion that can prevent a professional from delivering effective service, which will result in consistently functioning below acceptable practice and standards. This will result with the ethical code. Next. Okay, these are all the ethical code involved in professional impairment. The first one is American Association for Marriage and Family Therapy. They are stated marriage and family therapists seek appropriate professional assistance issue that may impair work performance. Okay, number two is National Organization for Human Services. Okay, in this act, stated that human service professionals strive to develop and maintain healthy personal growth to ensure that they are capable of giving optimal service to client. When they're not able to offer such service, they identify alternative service for the client. The third code is American Psychological Association 2010. In this code of ethics, stated that when psychologists become aware of personal problems that may interfere their work performance, they take appropriate measure whether should limit, suspend, or terminate their work-related duties. Finally, the American Counseling Association 2014. It stated that counselors monitor themselves for signs of impairment and refrain from offering service when impaired. They seek assistance for problems that reach the level of professional impairment, and if necessary, they limit, suspend, or terminate professional responsibility until they are safely resumed for work. Counselors assist colleagues or supervisor in recognizing their own professional impairment and provide consultation when warranted with sign of impairment and intervene as appropriate to prevent the imminent harm to client. Next. Okay. Maintaining vitality through self-care. Sustaining the personal self is an ethical obligation. As I stated before, there are a code of ethics that stated that professional have to that I have stated before. Counselor or psychologist or professional must take care of themselves so they can provide the competent service for the client. These are the ethical codes. So sustaining the personal self is an ethical obligation. Personal vitality is a prerequisite to function in a professional role. Ongoing self-care is an essential part of professional competence and personal wellness. Self-care positive action that promote wellness and effective coping include routine positive practice and mindful attention to one's physical, emotion, relation, and spiritual service. Self-care refers to positive action and that promotes wellness and effective coping. To work competent, clinician, counselor, or professionals need to acquire and regularly practice self-care and wellness strategies. Awareness of our current wellness is important to maintain personal wellness and promote to others. Take care of ourselves, maintain social and personal network, demonstrate concern for others. Good self-care associated with improved ethical behavior. Next. Okay. Therapeutic lifestyle changes is one way of self-care. Therapeutic TLC or therapeutic lifestyle changes promotes wellness for clients and practitioners or professionals. It is an effective as psychotherapy and pharmacotherapy. It can enhance health and well-being. It incorporates element of mindfulness, spirituality to promote physical and psychological health. These are the example of therapeutical lifestyle changes. Example, exercise, good exercise, have exercise, nutrition and diets, recreation and time in nature, have good relationship, have relaxation and stress management, religious or spiritual involvement, and service to others. Next, maintaining vitality as a counselor. Counselor or professionals need to learn how to compassionate to self. Counselor as a person and a professionals, like Mr. Sareh told us previously, your personal life does impact your professional life. Personal life impact the professional life. So we need to identify what is the beneficial or waste time, or what we can wait until tomorrow. Mindfulness refer to way of being aware of our thoughts, emotions, and sensations as they arise. This helps counselor relate to others, increase authenticity, acceptance, and empathy. Reduce reactivity to distressing emotion, thoughts, leading to more adaptive mode of consciousness. Client can benefit from a mindfulness counselor practice even if client are not practice mindfulness themselves. Self-compassionate can enhance counselor well-being, counselor effectiveness in the workplace, and therapeutic relationship with clients. That's all from me. So we can see a video about the whole story about stress and a way to cope with it. Thank you very much for listening.
Alright, thank you very much to all my group member, and thank you for all of you for your kind attention and lending your ears and eyes to our presentation today. So if you have any further question, we will discuss after the end of this video end. So thank you once again. Thank you for being an awesome listeners today. So that's all from us. Thank you.